The reservation system is put in place throughout Canada, forcing Indigenous communities to live on narrow, segregated tracts of land with contaminated water supplies. This led to mass outbreaks of typhoid fever and other illnesses. At the same time as the Chinese head tax was enforced by the Canadian government, making Chinese migrants pay $500 each while also denying all Chinese immigrants access to citizenship, Chinese laborers diagnosed with leprosy were denied medical treatment and banished to Darcy Island in British Columbia, where they awaited deportation. Many of them died waiting. After over 100 years of existence, the last residential school was closed in 1996. Indigenous children forcibly removed from their families were frequently inflicted with physical, mental, sexual, and spiritual abuse, and it's estimated that over 40% of the youth died from TB outbreaks, other diseases, or malnutrition. On June 30th, 2012, Minister Jason Kenney and the Conservative government introduced drastic changes to the Interim Federal Health Program, which cut access to medications, dental, and vision care for all refugee claimants. This is similar to what recipients of social assistance receive in Ontario. Also, refugee claimants from designated countries of origin, or so-called safe countries, now receive effectively no coverage for healthcare services, unless their illness poses a threat to public health or safety.
When I become a doctor, I may be forced to deny someone chemotherapy because of their immigration status.
When I become a doctor, I don't want to make people choose between their medicine and their groceries.
When I become a doctor, I may be forced to deny prenatal care to a pregnant woman just because of her immigration status.
We lobbied to the federal government, but our concerns have been ignored. Some provinces have already begun to fill in the gap. What will the situation be like when I become a doctor?
And this is why, as a medical student, today, I'm joining the movement for health for all.
I am joining the movement.
And that is why, as a medical student, today, I'm joining the movement for health for all.
And this is why, as a medical student today, I am joining the movement for health for all.